Hello, my name is Mike, and for my EMS how-to video I have chosen dopamine. So we'll start with indications: hyperperfusion due to myocardial infarction, sepsis, cardiogenic shock, congestive heart failure and pulmonary edema, contraindications, VFib and VTAC. Precautions: you want to correct any volume deficits prior to administering dopamine. You want to avoid mixing dopamine and sodium bicarbonate in the same IV line. The dose is going to be 5 micrograms per kilogram per minute. You're going to use a solution or a concentration of 1600 mics per milliliter. And the way you will do that is by taking 40 milligrams of dopamine, which is in 10 mLs, and you are going to put it in a 250 milliliter bag. You will do this with a syringe. You will take your syringe, your 10 ml syringe, and your 10 ml vial of dopamine with 40 milligrams. You are going to insert the needle into the vial, draw up the medication into your 10 ml syringe. Take your 10 ml syringe and inject it into your IV bag. Once you have mixed your 10 mLs or 40 milligrams of dopamine into your bag, you are going to shake it, and it will yield you a 1600 mics per milliliter concentration of dopamine, and that is the way you will start your dopamine infusion. Now, once you move on past your solution dilution, we'll move on to the clock method for determining how much medication to give. So again, we're going to start at a 5 micrograms per kilogram per minute distribution of this medication, and hopefully you can see this. The middle section will indicate seconds, so 60 seconds, 15, 30, and 45 seconds, and then it corresponds with the drops. So you have 60, 15, 30, and 45 drops, and it will have a corresponding dose. So if you have 15 drops, you'll be giving 400 micrograms, 30 drops, you'll be giving 800 micrograms, 45, 1200, and a full 60 drops in a 60-second time frame, you'll be giving 1600 mics. So, the easy way to do this would simply take the patient's pounds and subtract the last number. For instance, if you have a 180-pound patient, you would take the last number, which would be a 0, leaving you with 18, subtract 2, it'd give you 16. 16, we're going to start that patient at roughly 15 drops a minute, or 400 micrograms. That's kind of the easy, down and dirty way to do dopamine. You want to make sure that when you're doing it, prior to injecting, you're taking an alcohol prep, wiping the top of that, wiping the top of the vial prior to sticking the needle in and drawing up the medication, and then injecting the medication into the IV bag. I hope that helps. Thanks.